Hey, did you know that there's two types of sciatica problems? There's many causes to sciatica problems, but there's two main types that affect most people with sciatica issues. The first is a sciatica problem related to a herniated disc. Obviously, that's the worst of the two. Having a herniated disc is no joke. It takes some extra love and attention, but it actually can improve all the way without surgery, medications, or injections. The second type of sciatica problem is one related to the pelvis bones or the hip bones and the way that they're shifted or moved, or the muscles around them as well that can be spasming and putting pressure to pinch the sciatic nerve. Depending on which of those two conditions anybody's got, a sciatica problem can go one way or the other. If both are present, that's especially bad. Now, the best way to tell these two apart is not by pain. Both can hurt tremendously, both can hurt all the time. It's more about the location of the pain. If in a person they've got more back-related pain, it tends to be more of a herniated disc problem. Another common association with that back-related pain is pain in the leg, pain that goes all the way down the leg, all the way even into the foot, sometimes into the toes as well. Somebody who's got back pain and pain down the leg, it's almost always a pinched nerve from a herniated disc that can be contributing to that sciatica nerve type pain. But the way to differentiate it, if it's more of a pelvis related sciatica problem, it's usually just pain in the hip area. The buttock is the most common one, a pain in the butt, and also pain into the thigh, on the side of the thigh, sometimes the front of the thigh. Definitely the back of the thigh is a common place to get it. Now, it is possible to have pain throughout the entire leg, from the back, through the hip, into the knee, and all the way down into the foot. But the location usually tells us if it's more of a hip type of sciatica problem or a lower back herniated disc type of sciatica problem. So there you go, you have the two different kinds. Depending on which type of sciatica problem an individual has, treatment might go very different. For a herniated disc type of problem, the extent of how long it's going to take better is typically closer to a year, versus somebody who's got more of a pelvis problem might be more in the 3 to 6 month range. Either way, both instances can get better without surgery, injections, or medications, and it's often possible for people to get completely back to their normal activities without any limitations. Treatment is usually not painful for most people. It may involve certain exercises. In people with the hip problems, they'll usually do exercises that focus more on the glutes. In people with lower back problems, disc herniation problems, they may focus on exercises more so for the abdominals and back muscles. Hands-on treatment that we do here in the clinic is also focused on muscles that are spasming more so, or joints or ligaments or tendons that need to be freed up or moved by hand. And what we do here is just loosen up whatever's stiff and tight. So for somebody who's dealing with more of a herniated disc type of sciatica problem, we may spend more time in the spine, but oftentimes they do have problems into their leg, even all the way down into the knee and foot. We might spend some hands-on time there to alleviate the pressure on nerves so they can pass through the body the way that they're supposed to without being as irritated. And lastly, the advice that we give patients so that they can get more comfortable at home as far as sleeping, sitting, doing their everyday activities, driving, will change from individual to individual. For somebody who's got a herniated disc type of problem, we're telling them that they're having to change a lot about their position, about their posture. It is just a little more involved. But think of the alternative. If it's possible to get away without surgery and heal this problem 100% or as close to it as possible, they're usually very excited about that. For somebody with more of a hip-driven sciatica problem, then we don't have to talk about posture as much. It's going to be more exercise focused to get that long-term result so that this problem isn't returning over and over again. Hey, if you found this video was helpful, hit the subscribe button here to get notified whenever we release more content about sciatica and other body parts. If you want to see what we've already got in our YouTube channel playlist on sciatica, head over to our YouTube channel and find that playlist, and you'll see all the videos, all the tips and advice that we've already given away completely free for sciatica problems. We'll talk soon. Bye-bye.